there's an article this month talking about how surgeons are pushing to use guidelines that are not as strict. So anyone with a body mass index over 30, which is still defined as obesity, and with diabetes in particular, or if they've already tried to lose the weight on their own, have made a good attempt and still can't lose weight. And bariatric surgeons really who have followed any of the evidence and research know that that's true. From a physiological standpoint, these surgeries are of great benefit to people far before they get to a body mass index of 35 or 40. Nowadays, most guidelines that insurance companies use to qualify people for bariatric surgery is actually criteria that was defined in 1991, so almost 30 years ago. That criteria in 1991 was made when laparoscopic surgery didn't even exist. So nowadays the technologies to do bariatric surgery are much safer than they used to be, like significantly so, to the point where really the risks associated with surgery are very minimal. About 1 in 4, 1 in 3 among the entire United States population is dealing with obesity, so it's now really a nationwide problem, and it really is significant across the rest of the world as well. The American Society of Metabolic and Bariatric Surgeons have been trying to push this change in criteria for a long time, and the more people become aware of it, the more we can start actually trying to influence these insurance companies more, because the health benefits are significant and they're very well defined. The article that we're discussing actually talks about how there's a risk of increased GI procedures. That's almost negligible compared to the health benefits that occur by resolving diabetes, losing the weight, and getting rid of all those other health problems like blood pressure problems, high cholesterol, sleep apnea, joint problems. So there's definitely more advantages than disadvantages at this point.